Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, pediatrician in America. Today, our high yield pediatrics topic is on breath holding spells and temper tantrums. Breath holding spells is a transient phase in development of children in which they hold their breath, and when they are disturbed, it could be likely involuntary, and the duration of breath holding could be long enough that they may develop cyanosis or blueness of the face, and that really worries the parent. Before we go forward in this discussion, please subscribe to my channel and share and like this video. So these breath holding spells, they are usually harmless. They may be present in up to 4% of children, and may start between age 6 to 18 months, and most of the times they resolve until age 5 years. So sometimes they could have pale breath holding spells in which they could become pale and after holding their breath in the situation of frightness. And this is because of the activation of vagal nerve, which is one of the cranial nerves, and child becomes pale and limp. So usually the management is reassurance, and usually the typical scenario is that child gets upset, starts crying, takes a deep breath in and holds the breath. And parents advise that they can watch the child without hyperstimulating the child. The child will spontaneously start breathing again, and that is a kind of behavior. If the child tries to use this behavior to gain some advantage, that should be discouraged. And after watching the child for a minute or two, the child will restart breathing. Sometimes iron supplementation helps in making sure their hemoglobin is sufficient, and that has been shown to be useful. In kids who develop a spell of blueness when they're happy or excited, needs a cardiac evaluation by doing an EKG, making sure they don't have EKG problems like long QT interval or supraventricular tachycardia. But the most important thing is if it's just the child becomes upset, takes a deep breath and holds it, that is a typical breath holding spell which should be just watched and it self-resolves. A topic which is very close to it is the temper tantrums, which child, when they want to gain to have a secondary gain, they will do actions which are annoying. Sometimes they may lay down on the floor, they cry, and if you give in, that will strengthen that behavior. And it is common in between age 1 to 3 years. This comes when they are frustrated, hungry, or they are fatigued, they are bored, they are tired, and then they try to do this kind of behavior. It's not always manipulative or willful, maybe related to individual difference in temperament. Some kids are temperamentally different from other kids, and they may use this behavior to express themselves. Again, ignoring this kind of behavior will be useful, and not giving in will be important, and the child will eventually realize that, okay, I have to verbalize my feelings and not do this kind of behavior. And ultimately, most of the times by age 3 years, this behavior resolves. Sibling rivalry is another thing associated closely with this temper tantrum. The children get upset if they have a new sibling. What should be done? They have to be trained and explained that they are going to have a new baby, and if they once the baby comes out in this world, they show affection to their sibling. It should be praised that will be positive reinforcement, and such kind of behavior should be encouraged even in older siblings who become upset at their younger siblings. They have to be explained that you are the older sibling, you have to love and care your younger sibling. Another thing which happens behaviorally in young children is toilet training. Most kids are toilet trained by age 3 to 4 years of life, and this is something that parents show anxiety because the child is 3-year-old and or still not toilet trained. So they have to be patient sometimes because up to 3 years it could still be in the learning phase, and some kids may not develop later. The harder you will try, the harder it will get. So reassurance, sitting down with the child in the toilet, praising them, distracting them, increasing their fiber intake, scheduled times should be set up for their toilet, either in the morning, afternoon, or evening, whatever time is suitable, and let them sit on their toilet seat. You can read them a story, and if they are successful in urinating or defecating, positive in reinforcement by giving them a prize, sticker, could be done to reinforce this behavior. But never try to overforce it, because the more force which is used to encourage this behavior, the harder is it to train the child. And discipline wise, most kids, they should be timed out, explained. After age 18 months they can be timed out, for up to 5 minutes. They can stand in the corner, not facing you, not doing any activity, and that they will feel that they are being punished for some behavior that was not pleasing to the parent. They were annoying, disruptive, or not helpful. They were showing temper tantrums. You can do the time out and ignore their temper tantrum behavior just to improve their behavior. Excuse me. And this timeout behavior is really good. It's important not to do the physical punishment. It's more important to do these kinds of behavioral therapies for the children, so that they could be disciplined and they could develop good habits. Distraction is very important when they are disruptive or annoying or showing temper tantrums. You can distract them, have them color something, do some creative tasks, have them build something, use blocks, use Legos, those kinds of trainings, coloring books. They all distract their mind. Taking them out for a walk, having them play with their pet, having them do some chores, clean some stuff, can always improve their behavior. And sometimes taking away things can also improve their behavior when they know that, okay, they are old enough to understand. They will not get their iPad to play their game, or they will not watch their favorite cartoon if they don't behave right. So next time they'll be careful and develop the right behavior. Hope this video was useful for you. Please like this video, and I will continue to make videos on high yield pediatrics. Please share this video and subscribe to my channel. Thank you. Sallallahu alaihi wa alihi wa sahbihi wasallam.